Hey friends, welcome into Prescription Health. Today we are talking about all things teeth, kids' teeth to be specific.
And joining us today is Dr. Donna Klein of Pediatric Dentistry of Winchester. Welcome to the show.
Thank you so much for having me.
Well, and thank you for being here. Now, let's start off first of all by talking about what age should a child start coming to see a pediatric dentist?
Well, the American Academy of Pediatric Dentistry recommends within 6 months of their first tooth or by age 1.
Okay.
Okay.
Yeah.
And for parents out there, what can they expect on that very first visit?
So mostly it's education on how to take care of the child's teeth and when to clean them. We kind of look and see which teeth they have and which teeth to expect and when that time is. But like I said, it's mostly education, oral hygiene instructions, and nutritional counseling.
Because all models don't come fully equipped.
Exactly.
Yes.
You're not quite sure what you're dealing with
That's right.
with the baby
Yeah.
and the teeth situation. I'm curious too, Dr. Klein, what kind of special abilities do you need to have to be a pediatric dentist? I mean, infinite patience, I'm sure, has got to be in that list.
I've been told that, yes. So we have a 2-year additional training after dental school.
Wow.
And it's mostly for like physical, behavioral, and emotional health of the child. So from ages 0 to 18.
Okay, and is that what kind of sets you apart, a pediatric dentist, apart from a general family dentist?
Mostly, yes.
That
And that's
additional
just,
training.
Yeah.
My goodness, because kiddos are not going to be shy about letting you know if they're scared or new situations. So you've really got to kind of set the scene for them, right? Make them feel really comfortable.
Yes. So that's the majority of things. I feel like coming into our office, we try to make the children very comfortable. The parents are very nervous as well. Part of the reason why I wanted to become a pediatric dentist is because I saw so many adults that were nervous about coming to the dentist, and I thought, it starts at a young age, and it starts with their experience when they're a child.
So let me ask you this too. When do children start to develop their teeth, and when, does it start to be where they really need to come every 6 months, I'm sure you recommend often.
So children change very quickly and as they grow. And so again, like if they start at age 1, they develop most of their primary teeth or their baby teeth by age 3. So we like to see them then, even earliest on, and then they change and develop all the way through age 18. But they start getting their permanent teeth around 5.5, 6, sometimes 6.5. So we like to be able to educate the parent on the transition of primary teeth or baby teeth to permanent teeth. And
are you able to tell at a young age whether they're going to need like orthodontic work eventually?
Sometimes. That's a big question that we get a lot. So if their baby teeth have spaces, that's a great thing because it allows the permanent tooth, which is bigger, to come into that space. But they're also going to grow. Their mouths are going to grow. Their jaws and their bones are going to grow through their adolescent growth spurts. So that's going to allow space. But if their baby teeth are crowded, most likely their permanent teeth are going to be crowded.
Good information. I just remember Jack. His teeth were really, just very crooked, and we thought, oh, he's going to definitely need braces. No, his permanent teeth are perfect.
Yeah,
perfect.
Because he had that room.
He did. He had the spaces in between.
That makes sense now.
Yeah.
We needed you back then.
Yes, we did.
Tell us a little bit about the practice. What sets you all apart from others
So
out
I'm
there?
in Winchester, and it's just on the outskirts of Lexington, obviously. But I grew up in Eastern Kentucky, and I wanted to treat or service the patients or the people from that area as well. And a lot of those folks don't really want to come all the way into the busy Lexington.
Yes.
But so it's a kind of a win-win for me. I like that I do get to service a lot of my family and my friends from where I grew up.
That's awesome.
Yeah, so
wonderful.
Well, and making sure these kids are comfortable. I love that you started this whole journey with that in your heart.
That's fantastic.
So, very good. How can folks learn more about you and the practice and
so obviously
get that first consult going?
Yeah, we have a website. We can call our office anytime, but the kids especially, we have new patient appointments available anytime.
Okay.
Perfect.
Yeah. But for school-age kids, I know it's the end of the school, but parents really need to think about when, if they have a new child going to school, a kindergartner, they need to book those appointments early.
Yes.
Yeah.
Absolutely. Well, Dr. Klein, thank you so much. Good
Thank you,
information.
Thank you for coming in.
We've
We
been through
appreciate
this
it.
twice, and we've still learned something
I know.
today.
I learn
great.
something new every day.
So
I
nice to have
appreciate
you
you.
here.
Thank
Nice
you.
to have you. Thank you.
Back with more after this. Stay with us.